So in today's session, we will be discussing about respiratory infections, not from the textbook, okay, just general respiratory infections. And do we have any diet constrictions, and what is the role of nutrition when it comes to respiratory infections, okay? Not from the textbook, this is just additional extra classes that we take. So what is respiratory infection? It affects your respiratory system, and respiratory system is the part of your body that is responsible for your breathing, okay? And these infections can affect your sinuses, throat, lungs, airways, okay? And majorly there are two types of respiratory infection: upper respiratory infection, lower respiratory infection. So the upper respiratory tract, that consists of your nasal cavity, your nose, pharynx and larynx. Below that, starting from the trachea and the bronchi, lungs, these are your lower respiratory tract. So any infections happening here respectively will be categorized under upper and lower respiratory tract infections. Okay. So what is an upper respiratory tract infection? These infections affect your sinuses and throat. And upper respiratory infections include common cold, epiglottitis, laryngitis, pharyngitis, sinusitis. Okay. Common cold, that's because of your rhinovirus infection. Okay. Epiglottitis, you have an epiglot that covers your trachea. While especially the main function of this is to cover your trachea when you are swallowing food. Okay, so that the food does not get into the windpipe. It does not go into the trachea. Okay. Then laryngitis, larynx, the sound box, if that gets inflamed. Pharyngitis is pharynx is the end of your, when you open your mouth wide open, the end of your throat that you can visualize, that comes under the pharynx. Okay. Uh, if though that area is inflamed, usually as a part of tonsillitis and all, you get pharyngitis. Then sinusitis, you have hollows in your skull near your nose and all. There are hollows, and these hollows should be filled with air. Okay. And because of these hollows, you don't feel the weight of your skull. Okay. So these are the sinuses. So sinuses, if they get inflamed or infected, they get filled up with fluid. Okay. So that gives you that congestion. Okay. The lower respiratory infection, it affects the airways and lungs. In general, the lower respiratory infections last longer and they are more serious. Okay. These infections include bronchitis, lung infection that causes coughing and fever, bronchiolitis, and lung infection that usually affects the young children, chest infection, pneumonia. Okay, these are the most common lower respiratory tract infection. It takes very long to get over it. Okay, because if pneumonia and all happens at the lowest lobe of the lung, you can see these are the the lower part of your lungs. Okay, mucus and the infection has to be expelled out from these lower lobes, and it has to come through the trachea and be expelled out of your mouth or nose through coughing and sneezing. Okay, so it takes much longer for lower respiratory tract infections to recover from. Then what causes upper respiratory tract infection? You get an upper respiratory tract infection when a virus enters your respiratory system. Okay. Example, any virus or bacteria. Okay. It enters your respiratory system, and where it deposits and where it starts its inflammation from, you can say if it is lower or upper respiratory tract infection. Okay. And usually through contact transmission, airborne transmission, droplet transmission, there are various ways through which uh, you can get the infected bacteria or virus. So, viral infection, bacterial infection, fungal infection, allergies, nasal polyps, deviated nasal septum. Okay, these all can be the reason for why frequently you get any upper respiratory tract infection. Okay. So, who is at risk of upper respiratory tract infections? Anyone can catch it, like common cold and all, anyone can catch it. Okay. If you are spending time with people who have flu, influenza, common cold, you will also automatically catch it. But kids are at the highest risk. Children are at higher risk, especially for viral infections and all. And kids usually don't take care of their personal hygiene, like washing hands before they eat and all. Okay, they are not that hygiene conscious. Okay, so they are the age group which are at the highest risk. And people who already have heart and lung problems, okay, they are also susceptible to respiratory tract infections. Because of any lung issues, inflammation, asthma, or frequent infections and inflammation, the mucus lining of the lung and the respiratory system may shift over time. Okay, it may weaken over time. So it already puts you at the risk of developing infections. Okay, and also people who have weak immune systems, they also get respiratory infection. Either their immune system is suppressed because of immunosuppressants, or they're taking medicines to suppress their immune system. Okay. Or they generally have a weaker immune system as compared to the general public. So these are the people who are at a risk of respiratory infections. So how are upper respiratory infections diagnosed? Usually, you don't need a diagnose or specific treatment for it, like common cold and all, you don't require. But if at all you're breathing, your regular breathing, there is tightness around the chest pain, okay? If these serious symptoms are there, then you have to seek medical help, okay? Usually, you can just go for a checkup to an ENT specialist, ear, nose, throat. Okay. And they can examine your chest also if you're breathing properly. You don't actually need any other test. Okay. But if at all, if the doctor is concerned about any lung infection, okay, or any tumor or anything that could be quite serious, in that case, the doctor may prescribe you to do a chest X-ray, CT scan of the lung. Okay, you can do a PFT test as well, pulmonary function test, just to see what is the air capacity of your lungs. Okay, PFT is done for that to identify the air capacity, inhaling capacity, and all. Nasal swab, throat swab can be done if you, in case of flu, influenza, COVID, and all. You can do this swab. The swab will be taken to laboratory for bacterial growth and then identify what is the causative agent. Sputum test can be done. When you are doing sputum test, or if you are collecting the sputum, just make sure you don't do it in a closed room or closed environment. Go out in the open, then you have to do the sputum test. Okay, make sure in a dingy room, or in a closed room with four walls, doors shut, windows shut. Don't do sputum test in those kind of rooms where you expect others to come in the room. Okay, ideally in an open area you have to do the sputum test. You have to collect the sputum. So these were the diagnosis. Upper respiratory infections, usually they are contagious. Okay, they usually pass from one person to another to direct contact, droplets. Okay, airborne. It could be any form of transmission. Okay, so either if somebody has an infectious upper respiratory tract disorder, sneezing, coughing, especially without covering your nose and mouth, okay, that can propel the germs into air, and other people can breathe those droplets in, and they will become the host for the infectious agent. And if you are sneezing and coughing into your hand and then you're touching somebody else's hand without washing it or sanitizing, that can lead to spread of infection. So, what are the symptoms of upper respiratory tract infection? More or less, it is very similar for flu, influenza, regular common cold, and all. It's very similar: cough, fever, hoarse voice, fatigue, lack of energy, red eyes, runny nose, sore throat, swollen lymph nodes. If it is the infection has passed through the lymph nodes, okay, that is the swelling you will find in the sides of your neck. In case of mumps as well, you will find the same kind of swelling. How long do upper respiratory tract infection last? Usually for 1 or 2 weeks. Most of the time, they will go away on their own. Over-the-counter pain medication with these things can help you feel better. Make sure that you drink plenty of fluids to stay hydrated. And if at all your symptoms last longer than 2 weeks, then you have to visit a healthcare facility, do more tests done. Okay, because usually if it is more than 2 weeks, you may be suffering from pneumonia. Okay, and if not treated, that can lead to mortality as well. Then can antibiotics treat upper respiratory tract infections? Only if it is a bacterial infection. Okay, antibiotics cannot work on viruses. It can only kill bacteria. That's why it is antibiotics. For viral infection, you have antivirals. Okay, and most commonly, we have seen viruses are the ones who cause upper respiratory tract infections. Okay, bacterial infections are very rare. A lower respiratory tract infection can happen because of bacteria, like tuberculosis. Okay, tuberculosis is a lower respiratory tract infection, and that happens because of a bacteria. Okay, common cold and all is rhinovirus. It's a viral infection. So antibiotics will not respond to viruses. Okay, only for bacterial infection you can use uh, antibiotics like strep throat and all. You can use antibiotics. Penicillin, amoxicillin are the most frequently prescribed ones. High class antibiotics are not given for common cold or common influenzas. Then antibiotics should not be prescribed for common cold at all. Okay, it should only be prescribed when it is confirmed that it is a bacterial infection that is causing the respiratory situation, like sinusitis, pharyngitis, otitis media, bronchitis. In this situation, antibiotics can be prescribed because you know the causative agent is not virus. Unnecessary, if you abuse antibiotics or overuse antibiotics, that can lead to resistance. Means your body will stop responding to this particular antibiotic, which you are taking unnecessarily. So if you have any of these symptoms, you have to contact your healthcare provider or seek medical help. Loss of consciousness, high fever, usually if it is more than 103 Fahrenheit, rapid breathing, difficulty in breathing, chest tightness, okay, frequent and severe coughing, and Along with that, you may start vomiting as well. The throat, the region, because of excessive vomiting, that can cause a bruise and that can lead to bleeding as well. Dizziness, wheezing situation, which is high um, pitched whistling sound will be made when you breathe. Okay, you are not doing it purposefully, but it happens. Okay. Then retractions, that is what usually you see this in kids. Okay, kids who have infection and they're malnourished, if you can see, they're when they breathe in, the entirety of the rib cage, the outline of the rib cage is pretty evident. Okay, as compared to the breathe out. Then stridor is a raspy, vibrating breath that you have. Okay, and that is again more common in kids and adults. Usually it happens when you're laryngitis. Okay, because of laryngitis, the sound box, okay, that has got an inflammation as a result of a viral infection that can lead to stridor. Coming to the nutrition consideration, diet again is significant if even if you have this respiratory infection or not. Okay, certain macro and micronutrients, they play a very important role in maintaining your immune system. Okay, not exactly targeting respiratory infection, but in general, if you want to avoid respiratory infection, your immune system has to be strong, and there are certain micro and macros that help you with this. Okay, so zinc is it is studied that zinc, who those who are deficient in zinc, they have the link to getting common cold again and again. Okay, but if you are not deficient in zinc, naturally your body has a protection against common cold. Rhinoviruses cause common cold. Okay, and it is also seen that zinc and zinc supplements that can reduce the duration of common cold as well by 3 days. Okay, if you're supposed to suffer from common cold for few more days, zinc, if you have enough zinc in your diet, in your body, it can reduce the duration of common cold. Then fatty acids, several studies have seen that if you regularly consume omega-3 fatty acid, that can also reduce the incident of upper respiratory tract infection. That because the fatty acids, omega-3 fatty acids, keep your epithelial lining intact. Okay, they can take care of the free radical attack and they can take care of your epithelial lining. Okay, which is very important in the upper respiratory tract. Okay, the health of the epithelial lining is good when you take enough amount of omega-3 fatty acids. Then vitamin D supplements, some studies that they have done, it's seen that if you have enough vitamin D or if you are taking the supplement of vitamin D around 4,000 to 10,000 IU, international unit per day, it is significantly reducing the incidence of upper respiratory tract infection. And vitamin C, needless to say, it is usually associated with prevention of common cold and all. In general, it is accepted that vitamin C can prevent as well as treat common cold. Okay. It is also seen that in some mega studies, high doses of vitamin C, okay, for people who are already suffering respiratory infection and people who are being who have been under an environmentally stressful condition, like people who are marathon runners, skiing, people who go for skiing, soldiers who are exposed or positioned in a very severe cold climate. Okay, when they take mega doses of respiratory infection, it is mega doses of vitamin C, it is reducing the respiratory infections by 50%. Okay, the risk of developing common cold, it reduced by 50% in these specific target group. Okay, when they took mega doses of vitamin C supplements as compared to people who were not using any supplements. They regularly got common cold, but this 50% did not. So that's one study that we have that claims that vitamin C is supportive of prevention and treatment of common cold. So that's about the discussions. It's a very small chapter today. If you have any queries,